it is, it's a type of vaccine that we've been given for absolute years. It's a not live vaccine. So things like whooping cough and flu, which we've been given to pregnant women for many decades now, absolutely no adverse effect, apart from the usual sore arm, maybe a little bit feverish and things like that we'd expect from any vaccine. What it does do is it offers you protection, and it also offers the baby protection. Whooping cough specifically, we give purely to the woman to help protect her baby for that 8-week period before the baby starts its own vaccination programme at 8 weeks old. COVID works exactly the same way. The antibodies pass through the placenta and actually offer the baby protection as well. So you're not just protecting yourself, you're also protecting your baby.
So what we know is people react in all sorts of different ways to the jabs. Some people are completely fine, and when I had mine I had no symptoms at all. Lots of people get sort of a sore arm, and we do see quite a reasonable proportion of people who end up with a mild flu-like illness, usually for a couple of days. Anything more serious than that is really, really rare, and we know from the evidence that's just been published in the last week or so that actually the rates of those really serious things are less with the jab than they are with COVID itself. What we know, even with young healthy people who get COVID, is that generally they sort of laid out a bit more than that, sort of can be a week or two. And I look after patients with long COVID who've still not got back to work weeks or months later, even if they weren't unwell enough to end up in hospital.
If you've got an underlying health condition, you're at higher risk of complications from getting COVID. So I would strongly encourage you and the people around you to get vaccinated. It's very rare that someone isn't able to have the vaccine, usually due to an allergy of some description. If you're unsure though, get the facts. So on nhs.uk there's FAQs about the vaccine, or speak to someone at the vaccine centre or through your own general practice.
Definitely not. We've been given vaccines for decades, all sorts of vaccines, and rather than affect fertility of the population, we've actually increased the population because of lives that have been saved through vaccination programmes.
Yes, you do. We know with the Delta variant, which is the dominant one across the UK and worldwide, that unfortunately you don't get the full effect of the protection until you've had both your jabs and a couple of weeks afterwards. So whilst you've only had one, or straight after your second jab, you are still at high risk of getting it and being unwell with it. Once you've had that sort of window of the full protection, then we know the jabs are still really effective at protecting you.
Yep, the vaccines definitely work. That's why, despite having high numbers of cases of COVID in the country at the moment, far fewer people are being admitted to hospital, going into intensive care or dying from COVID-19. But it is still possible to catch COVID if you've been double jabbed, and it is still possible to pass it on to other people, particularly if their immune system isn't great. If you do get COVID, the illness is much milder than it would be if you hadn't had a jab. And it reduces your chance of going into hospital with COVID by about 90% compared with people who haven't been vaccinated. So they're definitely working.
So you're right that most of the people who get really unwell with COVID are either older, have got other medical problems. Young people can get unwell, either sort of a bad flu-like illness, or things that make them feel really off it for weeks or months later. Some do unfortunately get really unwell, end up in hospital, and even see in some cases intensive care, and very rarely passing away as well. We know that the jab with the Delta variant, it doesn't stop people getting COVID like it was with the other variants, but what it does, it stops people getting really, really unwell. So we think even though you're young, you probably won't be too unwell with COVID, but there's a small chance that you will be, and the jab really cuts down that chance and lets you carry on with life a bit more normally.
Because the risk if you're pregnant is now, not in 6 months or a year, we've got a whole group of population that have not been vaccinated. being pregnant women, and obviously restrictions are lifting, people are moving about more freely, the world's returning to normal, hopefully. So the risk is to you now. So we want you to be protected, we want your unborn and your newborn baby to be protected as well. So it's about what's happening now, not in 6 months or a year. Probably can't wait that long.
The vaccines are safe. They went through all the usual stages of testing that any other new medicine would before it was approved for use, and this included testing on volunteers ranging from people from different ethnic groups, people aged from 18 to 84, children and young people from 12 to 17, people with different health conditions, and since they were tested, more than 5 billion doses have been given throughout the world. 76 million here in the UK. So we do know that they're safe. Serious side effects can occur but are very rare and much less common than the side effects you get from getting COVID-19.
Yes, there is, because whilst you do get you're right, you do get the antibodies when you've had the infection, and naturally, what we know is that the sort of strength of the immune response and the both the length and effectiveness of it is less than you get with the jabs.
Well, it's great that you want to be vaccinated to protect yourself and those around you as well. There's no need to be embarrassed. Just go to nhs.uk, and from the homepage there you can follow the link to either book yourself a jab in an appointment or to find a walk-in centre that's convenient for you to drop in and have it done.
You should make your own decision for the health of you and your unborn. It's not your friends or family that are carrying your baby, it's you, and you've got to do and be protective, show protective motherhood, and obviously your partner as well. That's really important. Not just you. It's not just down to you. It's down to your partner as well. You have to do the things that protect you and your family, and that's what motherhood is about: nurturing and nature. I would just say that all the evidence is there that babies can become quite poorly. The antibodies cross the placenta and offer protection to the baby as well. So you aren't just protecting yourself, you're also protecting your newborn. And if you put that slant on it, you're protecting 2 lives, not just one.
In the UK, the Pfizer and Moderna vaccines are a type called MRNA vaccines, and they're made using a different process from AstraZeneca, for example. But the clinical trials on volunteers and the widespread use in the UK and throughout the world of both types of vaccine show that both work and both are safe.